Rafaele, tell me, how does sound therapy help children?
Well, sound therapy is very important for children, Donna, because, well, with children it's all about learning, and unfortunately today many children have struggles with learning. They have learning difficulties. They have problems like ADD or autism or dyslexia, different things that make it hard for their brain to take in information easily the way it should. It should be easy for children to learn. So when it's not easy, it means that something in their processing of information is not working quite as well as it could. And sound therapy can facilitate that process. So when a child listens to sound therapy, it's stimulating the brain pathways, it's building connections in the brain, and it's helping them to be able to perceive their environment the way they should. So it helps, for example, with auditory processing. And what that means is what the brain does with the sounds we hear. We may be able to hear, but when that information gets to the brain, it may get mixed up. Sound therapy helps that all to come into the brain in the right order, at the right speed, so that the child can comprehend and learn easily. Hear the letter sounds, get them in the right order, just perceive and understand. And when we work with the auditory processing, that also impacts other types of processing, such as visual processing, vestibular, which is the balance sense, the kinesthetic, the sense of touch. All of those other pathways of information coming into the brain, they all connect together in the brain. And sound therapy, because the auditory sense is such an important sense, it helps them all to come together in an organised fashion, and it's easier for children to learn. Donna, I know you also work with children with hearing loss or children with ear infections. How do you see sound therapy coming into that field?
Rafaele, I think that sound therapy is a critical component to children that have ear infections. Let's address ear infections first. Okay. We know children that have ear infections are hearing at a reduced level, like they're hearing through a filter. So it's going to cause an immediate issue with language development, expressive, receptive language. And so I would recommend sound therapy for all of these children with ear infections because of the fact that we can sort of override that blockage and allow them to get access to those sounds even during the times that they have ear infections. So I think that this would be wonderful to put on any child that has frequent ear infections. And then, of course, the volume may need to be altered depending on that. And they could work with their audiologist. The parents could work with their audiologist in relation to that.
Terrific. And what about children with long-term hearing loss? How would you see the program applying to them?
Well, we know that children with long-time hearing loss are going to have challenges throughout their lifetime. And even with the use of a hearing aid, for example, in a school situation, there's tremendous amount of background noise, and hopefully these children that are wearing hearing aids are wearing some type of what we call an FM system, where the teacher has a microphone that's helping bring that signal up so they can get better access. I feel that the sound therapy being utilized the off time when they're not in school is going to help the brain remap and actually become, it's going to be easier for that child to filter all of that competitive sound that they're being exposed to during the day. So I think it's going to give them that additional edge to have their auditory system fine-tuned so that they can handle all of that competing sound. And so, and that's a challenge for a child with hearing loss, and particularly, which will then affect reading and all of that. Exactly. So I think it's just, I would recommend, you know, reading your book, Why Aren't I Learning? And take a look at, that's a fabulous book. It has a wealth of information in it, and teachers, educators, it's endless, the benefit, but children particularly, this is just really critical.